Early detection is key when it comes to beating breast cancer. But what if you're at a higher risk for the disease? In today's Healthwatch, a program at Aurora BayCare Medical Center that specializes in high-risk patients.
My aunt on my dad's side had breast cancer when she was younger and again when she was older. And my mom had breast cancer. She was diagnosed in 2019 and she still is fighting breast cancer. So yeah, I have a very strong family history of breast cancer.
Knowing her family history with breast cancer saved Jamie Furman's life. Along with family history, things like age, breast density, and body mass index can determine a person's lifetime risk for breast cancer. After bringing up her mother's diagnosis to her primary care doctor, Furman was recommended for the high-risk breast cancer program at Aurora BayCare.
We allow patients to see somebody from the breast clinic, so we can talk about increased screening with possibly adding MRIs and ultrasound onto your regimen. We also offer them to see genetics at that same time if they qualify for genetic testing. And then they also will see someone from the medical oncology department to consider risk-reducing medications if they qualify. So it's convenient for patients because they can get sort of all three visits wrapped up in one time.
In the high-risk program, Furman started yearly mammograms and MRIs every 6 months. That MRI discovered her cancer at age 39.
I was completely taken aback. I really didn't think anything was going to be wrong. And it was a fairly large tumor. And my mammogram did not show anything, so my MRI picked it up, which thankfully I had it done. And it was a really hard day. It was a lot of sadness and anger and a lot of unknown with my husband and I, and what do we do next, and am I going to be okay?
Thankfully, the high-risk program had a care team ready to attack Furman's diagnosis.
Everything was really laid out very quickly, and you could sense the urgency with the clinic. But right away it was, we need to start chemo and we need to start moving forward very quickly.
Furman is finishing chemotherapy and then she'll move on to surgery. She has a new outlook on life and wants other women to make sure they know their history and advocate for themselves before it's too late.
I am incredibly thankful. I think if I would not have brought it up at my physical, or if I just never would have made the appointment with the high-risk clinic, I would be in a much dire situation in my 40s when I did start mammograms. All of the doctors have been nothing short of amazing, and the nurses. I feel really confident in my treatment plan, but I am so thankful that I brought it up and talked about it and said, hey, what can I do so that I'm not in a really bad situation in a few years.
Tomorrow in Healthwatch, around 48 million people get foodborne illnesses each year. Could the culprit be in your kitchen?